Hi, my name's Sarah Brown and I'm the CEO of the Purple House. Our other name is Western Desert Ngunnawal Palinjaku Jutiku Aboriginal Corporation. That name is Pintabee and our bosses are all Pintabee people from the Western Desert. It means keeping or making all our families well. So it was in recognition that if people had to leave their remote communities to come into Alice Springs for dialysis, they were sick and homesick, but they're also missing from their communities. So our bosses had an auction at the Art Gallery of New South Wales 22 years ago, painted some extraordinary paintings and raised $1 million in one night. And the aim originally was to get a dialysis machine in Kintore so that people could spend time home on country with family. We did that in 2004, and since then we've had a variety of other communities asking us to help them to get dialysis in their communities, which resulted in a Medicare item number based on our model of care. So now any remote community across Australia can do a dialysis in their community and get Medicare funding. And that wouldn't have happened if it wasn't for the Purple House. Beyond that, people had their own place and their own organisations, so they developed other services that they wanted. So we now run aged care and NDIS, we've got a social enterprise making bush medicines, we've got a primary health care service based in Alice Springs, and we've got dialysis in 19 remote communities and the Purple Truck. So from that original idea of getting a dialysis machine in Kintore, has developed this whole new model of care, which is based on looking after family on country, cultural priorities front and centre, and relationships and looking after each other. So of course we also have big plans for the future and many more things that we want to do, and we can't do that without good staff. We have extraordinary people working for us, and I guess the question that many people would ask is, I have so many opportunities as a dialysis nurse, why would I come and work for the Purple House? And I would say, life's too short not to give it a go. The difference with us is that the patients and their families are our bosses, that we're low on bureaucracy, we're high on safety. We're all about relationships and doing the very best with what we've got and looking after people. And so it's an opportunity for nurses to live and work in a really beautiful remote area and learn language and go hunting, but also to provide the very, very best care to a much smaller number of people than you would in a hospital, and where we're always listening in terms of opportunities for you to learn and to grow and develop your skills. So that's us, and if you're going to have a New Year's resolution, I reckon it's get in touch with the Purple House and come and have a play.